World AIDS Day is a global movement to unite people in the fight against HIV and AIDS. This healthcare event is observed every year on the 1st of December for the past 33 years since 1988. On this day, various awareness campaigns and activities that promote the disease awareness are conducted by several organizations across the world to show solidarity for people living with HIV, human immunodeficiency virus, reminisce those who have died from an AIDS-related disease. Key facts. HIV remains a major global public health issue, having claimed an estimated 42.3 million lives to date. Transmission is ongoing in all countries globally. There were an estimated 39.9 million people living with HIV at the end of 2023. An estimated 630,000 people died from HIV-related causes and an estimated 1.3 million people acquired HIV. There is no cure for HIV infection. However, with access to effective HIV prevention, diagnosis, treatment and care, including for opportunistic infections, HIV infection has become a manageable chronic health condition, enabling people living with HIV to lead long and healthy lives. WHO, the Global Fund and UNAIDS all have global HIV strategies that are aligned with the SDG target 3.3 of ending the HIV epidemic by 2030. By 2025, 95% of all people living with HIV should have a diagnosis, 95% of whom should be taking life-saving antiretroviral treatment, and 95% of people living with HIV on treatment should achieve a suppressed viral load for the benefit of the person's health and for reducing onward HIV transmission. In 2023, these percentages were 86%, 89% and 93% respectively. In 2023, of all people living with HIV, 86% knew their status, 77% were receiving antiretroviral therapy and 72% had suppressed viral loads. These facts self-explain the need of AIDS Awareness Day. To achieve the goals of ending HIV epidemic, each year a theme is assigned around which all activities in this direction are centered. Theme 2024. Take the Right's Path, My Health, My Right. This theme emphasizes the importance of upholding human rights to combat the HIV or AIDS epidemic effectively. It advocates for the removal of legal and social barriers that infringe on people's rights, such as discriminatory laws and criminalization that hinder access to healthcare and social support for people with HIV. The campaign aligns with the principles of the UN Declaration of Human Rights, asserting that protecting everyone's right is crucial for ending AIDS and ensuring sustainable health outcomes globally. The theme also encourages leaders and communities to promote inclusive policies and create legal frameworks that support HIV prevention, treatment, and care without stigma. Why this theme? The substantial progress that has been made in the HIV response is directly linked to progress in protecting human rights. In turn, the progress made through the HIV response has galvanized broader progress in realizing the right to health and strengthening health systems. But gaps in the realization of human rights for all are keeping the world from getting on the path that ends AIDS and are hurting public health. And now a surge in attacks on rights is threatening to undermine the progress that has been made. Ending AIDS requires to reach and engage everyone who is living with, at risk for, or affected by HIV, especially including people who have been most excluded and marginalized. Gender equality is an essential element of an approach to AIDS that is grounded in human rights. Acceptance, respect, and care are vital. Laws, policies, and practices that punish, discriminate against, or stigmatize people because they are women or girls or from key populations or from other marginalized communities obstruct access to HIV prevention, testing, treatment, and care. So do laws, policies, and practices that hinder the work of people who are providing vital HIV services for affected communities or who are advocating for reforms. So, there is an urgent need to remove criminal and other laws which harm people's rights, and an urgent need to enact laws and approaches which uphold the rights of every person. The world can end AIDS if everyone's rights are protected, with human rights at the center, with communities in the lead. The world can end AIDS as a public health threat by 2030. That is why the theme, Take the Rights Path, My Health, My Right, has been chosen this year. The UN AIDS campaign highlights the achieving of the goal of ending AIDS depends on protecting human rights, ensuring equitable healthcare access, and fostering a supportive environment for people affected by HIV or AIDS throughout December and beyond. The upholding of everyone's human rights is an essential underpinning of an effective HIV response. This World AIDS Day is a call to action to protect everyone's health by protecting everyone's rights. Leaders need to take the rights path. Key messages. Health is a human right. Everyone should have access to the health services they need, including HIV protection, treatment, and care services when and where they need them. Prevention empowers and protects. Empowering individuals with access to HIV prevention tools, education, and services protects not only their health but also their rights. Equal access to prevention is the key to stopping new infections. Address stigma and discrimination. Stigma and discrimination undermine the fight against AIDS. Protecting human rights is essential to achieving universal HIV care and breaking down barriers to access. Prioritize and reach vulnerable key populations. Ending AIDS requires that we prioritize and engage everyone who is living with, at risk for, or affected by HIV, including vulnerable and marginalized populations. Children, men who have sex with men, transgender people, people who use drugs, sex workers, and people in prisons and other closed settings. This is essential to ensure an effective and durable response to HIV that honors the right to health. Champion access to life-saving treatment to achieve HIV viral suppression. With early diagnosis and consistent antiretroviral therapy, people living with HIV can lead long, healthy lives just like those who are HIV negative. Achieving and maintaining an undetectable viral load by taking antiretroviral therapy as prescribed means zero risk of transmission, empowering individuals, and protecting communities. Advance towards an AIDS-free future. By protecting everyone's rights to health and bringing down new infections, we can achieve an AIDS-free generation and ensure the sustainability of the HIV response. calls to action. World AIDS Day 2024 calls to general public to advocate for policies that ensure everyone has access to HIV prevention, treatment and care. Share your support on social media using hashtag World AIDS Day 2024. Learn about the inequalities driving the AIDS epidemic and educate others. Support local health initiatives working to end AIDS. Join global and local campaigns demanding health as a fundamental right. World AIDS Day 2024 calls to health workers to advocate for access to essential HIV services, incorporate HIV into routine health interventions, deliver care that is kind, respectful of human rights, and without stigma. World AIDS Day 2024 calls to ministers of health, national AIDS commissions, and other public health leaders to allocate sufficient resources to improve the quality of HIV services, to focus efforts to reach populations that are vulnerable or that are key to the HIV response, to empower communities to combat stigma and discrimination, to support and empower frontline health workers, nurses, midwives, and community health workers to deliver high-quality HIV services while recognizing their critical contributions. World AIDS Day 2024 calls to civil society to help to reach vulnerable, stigmatized, and other difficult-to-reach populations, to speak out against stigma and discrimination, to help young people take leadership in the AIDS response. World AIDS Day 2024 calls to community leaders to ensure essential HIV services are maintained in the community, to reach out to key and vulnerable populations and assist them to access HIV services when needed, to ensure that adolescents, youth at risk, pregnant women, and infants receive adequate care that incorporates HIV, to support health workers to provide HIV services to everyone in the community. World AIDS Day 2024 calls to HIV program managers to focus on key and vulnerable populations for delivery of HIV services, to support and empower health workers to deliver high-quality HIV services, and to ensure adequate training in HIV services for health workers. Investment in AIDS will be repaid 1,000-fold in lives saved and communities held together. Let's unite in this fight against AIDS and play our part.